Okay, good morning, everyone. We're going to go ahead and get started. My name is Denise Kranich. I am the Director of Development for the Medical Society of Virginia Foundation, and we are pleased to welcome Curi for our webinar this morning. And the name of the webinar is Connect to Lead, Caring for Yourself and Others During the COVID-19 Pandemic. We would like to thank Curi for their sponsorship last year for MSV's virtual annual meeting. We really do appreciate all the support of our members. I would like to take a moment to welcome our speaker, Jason Horay. Jason Horay is the Manager of Health Strategy and Wellbeing at Curi, a company committed to helping physicians in medicine, business, and life. In this role, he serves as Health Promotion Program Manager for the North Carolina Medical Society Employee Benefit Plan, where he partners with brokers, producers, and vendors in supporting nearly 500 medical practices and 11,000 covered healthcare professionals. Jason has also held well-being leadership roles at Duke University, IBM, and Cisco Systems. Jason earned a bachelor's degree in sports medicine from High Point University and a master's degree in health promotion, health education from Mississippi State University. Now a few housekeeping items. If you'd like to ask a question, please utilize the Q&A function at the bottom of your Zoom screen. If your question is not answered, please email the MSV team at memberservice@msv.org. As it is with all of our webinars, this session will be recorded and posted to our website. On behalf of all of the membership and staff at the Medical Society of Virginia, I would like to thank all of you for taking some time to be with us this morning. I will now hand it over to Jason.
Thank you, Denise. Good morning, everybody, and welcome to our webinar this morning. And, as you know, we, the world, everybody is experiencing a dynamic and constantly changing situation with the spread of COVID-19. And operating on the front lines of efforts to protect our communities, our physicians, and our healthcare professionals, we've assumed tremendous responsibility while trying to adapt to the many new challenges that this pandemic has introduced to us. Our physicians, our administrators, and their practices are dealing with higher than normal levels of stress, anxiety, worry, and emotional and physical exhaustion, especially now. So it certainly did exist, but especially now since the COVID-19 virus. And as we know, emotional support is so crucial right now. And at the end of the day, at the end of this webinar, I really hope that this message resonates with you and allows you and inspires you to support each other while also fostering a sense of compassion. We are waking up every single day now to a new normal. Overall, what we have been accustomed to is certainly changing. The nature of our work has changed. Overall, what is required of the shift has changed. The overall balance of work and family has certainly shifted. And maybe you're saying things like, well, behind my ears hurt so much because I'm having to wear this mask all day, and I'm so glad at the end of the day to get it off. And I'm getting headaches throughout the day because I feel like my breathing is not as effective. And it's awful. We're double gloved and double masked, and it's just plain uncomfortable, among many other things. So our journey today, for the next 50 minutes or so, we're going to talk about how COVID-19 has disrupted the workplace or the practice, some components of self-care, self-compassion, and gratitude, and then strategies to consider and how to address your own resilience while also looking at and addressing your practice's culture and efficiency. And we'll kind of round out the webinar with ways that you can support your employees during these stressful times. So let's spark a little curiosity, kind of like looking a little bit inward. To be successful, I believe that we need to start with ourselves. So let me ask the question, who are you? It's a pretty profound statement, question, sentence. But how are you showing up each day? How are you using your strengths to lead your practice? I believe that people will believe what they say you do more than what they hear you say. And that's why it's important to regularly reflect and ask yourself, what story are you telling versus what story are they hearing? So meaningful stories are personal. They're not about being clever, and they overall require us to be vulnerable and honest. And I found in my own work and my own journey that when I'm most vulnerable, that's when I feel most alive and when other people are most impacted. Now, I used to, with all honesty, hide behind a veil of perfection, assuming that, if people truly knew the flawed aspects of who I am and who I was, they would reject me or think less of me. But at the end of the day, the opposite happened. Because there was a time in my life when my work-life balance was off. In short, I wasn't living a life that was true to who I truly was. And ultimately, it affected every aspect of my life, including my physical and mental well-being and my relationship with my family and friends. And I contribute this off time to lower back issues that led to surgery, significant weight gain, and also depression. And fortunately, I sought out meaningful connections with loved ones and really began to pull myself up, seek medical attention, and build the courage and the confidence that I needed to take risks. And once those components were addressed and authenticity was established within myself, I began to heal. Now, I understand that each day, and for myself, is truly a challenge. And I continue to strive to be the person and father who I want to be in this world. And I truly have realized that life is a journey, and it's about growing and changing and coming to terms of who and what you are and loving wholeheartedly that person. I know that you have certainly heard the word burnout. It is something that we hear almost every day, especially when it comes to healthcare providers. But simply put, we're not going to go into a lot of data and literature on burnout, but burnout is running on empty day after day. For many healthcare workers and providers and physicians and PAs, this has come at an overwhelming physical, mental, and emotional price. And certainly to an extent that we will not fully realize for years to come. And each person's experience of trauma is unique, and it affects them very differently at very different times. The three components of burnout, the first one, emotional exhaustion, that's truly having a decreased joy in the profession. It's more than just having a bad day. There's just no more joy found in the profession or why you got into this field or industry in the first place. The second is reduced performance. And that's when one begins to slack off because they're no longer interested or they care about the profession. They're sort of in the survival mode as they contemplate leaving the industry. And then the third is interpersonal disengagement. And this is the negative attitude caused by burnout. It begins to affect all aspects of a person's life, whether it's work, home, and also relationships. And I'm sure at your practice, you could probably visualize or think through your staff and identify a person with that interpersonal disengagement. It happens all the time. Now, the pandemic has changed everything, and I often speak about clinician burnout and emotional distress. But because of the gradual nature of burnout, some don't truly understand or recognize the drivers, which are work overload, lack of control, insufficient reward, breakdown of community, absence of fairness, and conflicting values. Now, these drivers of burnout are now on steroids and are at a place like none before. And, I ask you if you are seeing these elements play out among yourself, your practice, or other providers. Now, nationally, it's estimated that 76% of full-time employees experience feeling burned out on the job at least sometimes. Now, when I speak about physician burnout on a national scale, the Physicians Foundation estimates way over 50%, of physicians experience burnout. Now, these stats come from Gallup, which is an organization that measures employee engagement. Now, when left unrecognized, as you know, these symptoms of burnout can lead to dire consequences among your staff and the people who report to you. Employees who say they are very often or always experience burnout at work are 63% more likely to take a sick day. One half is likely to discuss how to approach goals with their manager. 23% more likely to visit the ER. 2.5 times as likely to be actively seeking a different job, and 13% less confident in their performance. We are a little more than a year into this statistic, but back last year in March, it was estimated that the impact of COVID would have a significant impact on healthcare providers. And I'm sure these numbers are elevated as we see them here, but about 45% have an increase in anxiety, a little over 50% in depression, and 34% with sleep issues or insomnia. Now, there are many components that make up you as a person. So set aside your role as a physician, as a provider, as a PA, as a manager for a moment. And we're going to dive into something about kind of who you are when you look into the mirror and things that you can consider as self-improvement. Now, when so many things are changing rapidly, it's hard to consider investing energy into a new routine. It may feel like the moment you get settled in, things will likely change again, and that's valid. However, the reality is that nothing you're experiencing today is similar to anything you've done or we've done before. So that can be very unsettling from day to day. In order to establish a new normal, knowing that it could change again soon, try taking a lighter approach. When you have time, maybe this afternoon, when you're sitting outside in this beautiful sunlight today, take 15 to 20 minutes and ask yourself, what is expected of me now related to my work, my parenting, my caregiving, etc.? And are there any patterns that emerge from those expectations? Take a moment to consider what overlaps occur in your day-to-day priorities. And then once you have a sense of patterns, how might you construct your daily routine more effectively? Now, there is no right or wrong emotional response to the pandemic, and it certainly can be challenging to avoid feeling fearful and uncertainty when many of these things are out of our control. So I ask you, are you feeling overwhelmed or experiencing any of these symptoms due to your current situation? Your emotional and mental well-being are as important as your physical well-being. So take a step back and ask yourself, am I reacting with constructive or destructive behaviors? Constructive and positive ways to cope. Now, taking, these are all sort of a little bit of an aha moment, but maybe things that you already do, but taking breaks from watching or reading or listening to the news. Certainly something that I have done in my own life, could not even tell you a current event. Although sometimes I'm not proud of that, but I have totally disconnected from the news. Limit your time spent on social media and monitor your response to stressful events. What do you see and what do others observe about you? Also, it's essential to practice good self-care and healthy behaviors, exercise, good nutrition, and adequate sleep. Social interactions are also essential. Connecting with others and sharing your authentic feelings. And then also, of course, seeking emotional support. Viktor Frankl is an Austrian psychiatrist and Holocaust survivor. And he said that everything can be taken from a man but one thing, the last of the human freedoms, to choose one's attitude in any given set of circumstances, to choose one's own way, meaning that even in the most terrible circumstances, a person still has the freedom to choose how they handle their circumstances and truly create meaning out of them. You may have heard this statement, but it's okay not to be okay. You are experiencing something that you've never experienced before. and there will be a lot of feelings that may surprise you. Notice these feelings without judging them as good or bad, worthy or unworthy. There is no right or wrong to respond to what you're experiencing. A special person in my life once told me it's easier to be happier when you realize that you don't have to be happy all the time. Now, financial insecurity or security or lack thereof has a major impact on many areas of our life. So the weight of financial burden is heavy during this pandemic, and it's something that many are feeling. Loss of work, loss of business, practices closing, reduced patient flow, reduced hours. So that creates a lot of financial uncertainty. So a couple tips, very high level, connecting with your financial advisor, creating that budget, working with your human resources or a leader within your practice to figure out any sort of resources that your practice offers, and also leveraging your employee assistance program for the information that they have. Finding balance is hard. And right now, you may be trying to do full-time work, helping your school-age children learn if you have kids, and or caring for your children or as a caretaker for an elderly person. But to believe that you will be able to maintain a similar, so pre-COVID schedule is unrealistic. And everyone will need to adjust and certainly continue to find their balance here. So some tips to finding your balance, really start by adjusting and becoming realistic, truly realistic about your own capacity. Communicate with leaders within your practice, perhaps your child's school teacher, and consider creating a schedule that will allow you to be fully present day after day. There might be things that take you away, but if you could find a way to be present within your family unit or a household unit, that's always best. And giving yourself a lot of grace. Because you are not expected to be the world's best teacher, parent, or employee during this time. You will have good days and rough days, and that is okay. So be honest and open with your employer, your partner, and your kids, and ask for help when you certainly need it. Now, this might seem like an absurd question to ask right now. What is going well? However, it's a meaningful one. In the midst of so much change, we are often able to gain a lot of insight that can result in long-term lifestyle improvements. So take a minute and let yourself wander a bit. Have the changes you had to make because of the pandemic revealed any truths about yourself or your life that may be meaningful? What changes have I been forced to make during this time that have actually made my life better? What were things that I kept up, even in the midst of losing control, because they were most important to me? And in the past 2 weeks, what has brought me joy? What is no longer happening in my life that has been surprisingly relieving? And then what have I been able to invest in that has been meaningful? Finally, maybe what do I hope to keep up after all this is over? Now, social connection is a key part to our overall well-being. And in times of social distancing, it might seem like a good idea to create a lot of extra support to socially connect with people. However, right now, the best thing that we can be is intentional about our social connections and ensuring that our connections are of high quality. Because, it's hard to think of the profession of medicine as a lonely profession. After all, we're surrounded by patients and office staff 10 or more hours each day. But 1 in 5 Americans often or always report feeling lonely or socially isolated. And there is a clear correlation between feelings of isolation and rates of burnout. We all have a fundamental need for human connection. So as we are removed from the places where this happens naturally, like the practice, we need to replace it somehow. Lack of social connection and physical isolation are going to be the norm for a while. And we need to remember that we all have a fundamental need for human connection. So some tips and strategies: check on those that you care about. Elderly, neighbors, people that you haven't connected with for a while. Avoid connection that amplifies anxiety. You know that some people have these people in their lives that they just feel like they have to reach out to. It doesn't bring them any joy and meaning and fulfillment, but avoid those kind of connections. Only bring in connections that bring you satisfaction within your life. Find someone to have a conversation with that acknowledges your fears and reminds you that you're in a safe place and that you're loved. And the connections are, and also invite goodwill, kindness, joy, laughter, and peace. Really at the end of the day, who fills your bucket? Brene Brown is the author of Daring Greatly, and she shares that connection is why we're here. It is what gives us purpose and meaning in our lives. So I ask, what are you doing to stay connected with family, friends, and colleagues? One organization that I found very helpful is Tribute.com. And in the spirit of spreading joy and appreciation, they're offering a 100% discount on a do-it-yourself tribute. So whether you've missed a special occasion like a wedding or an anniversary or a birthday, you can go in and create a montage of personalized videos that you reach out to others in your network and kind of put them all together for one do-it-yourself video. And I've used this quite a bit for personal reasons and at work, but it's a really great way to connect with others in times where we haven't been able to be present with certain celebrations. Movement is also important and can be even more so in a crisis, because when individuals start to feel shut in, cramped, and anxious, physical movement can help them feel expansive and also relaxed. So taking several small 15-minute breaks to walk outside and connect with nature. Climb your stairs if you have them. Yoga with Adriene is a really cool YouTube channel that provides yoga classes online. And a lot of local fitness companies are moving to virtual group class setting. And that's always a great way to connect and take care of physical activity while at home. And remember that stretching does count. I also feel that social distancing has created an increased opportunity to get healthy foods into your body. Because, we're home a lot, we have the ability and the time to kind of create these meaningful moments around food. And a couple of reminders here that food is meant to nourish you, and there's no such thing as a superfood. Try making, again, 5 to 9 half your meals, fruits and vegetables and beans. And now is not the time to truly overhaul your diet right now. And don't judge yourself for buying non-perishables, because we're in a phase of sort of stocking up. So also, don't disregard rest and play. 25% of American adults report not having sufficient sleep, and lack of sleep, as you know, supports the increase in chronic diseases such as diabetes, heart disease, obesity, and also depression. So take that time to read a book. Enjoy time sitting outside on a sunny day. Today is a great time for you to do that. Turn on your favorite music and dance around the living room or the kitchen. Take a nap or go to bed earlier. Play virtual games with friends. Go for a walk and enjoy the sights and sounds of nature, especially now in the spring where there's such great new growth and you feel that energy from a new beginning. And then perhaps go out for a bike ride with your family. But stress, anxiety, fear, and grief are all higher than normal during this pandemic. And collective suffering is high, which also means collective need for kindness and gentleness with each other is also high. So as you find yourself feeling grateful or hopeful, find an intentional way to share that with others. If you notice that someone is feeling down, reach out to that person and share that kindness and compassion. And then also connect with your friends and your coworkers and families to share ideas on ways that you find happiness during this difficult time. A special person in my life says that happiness is when what you think, what you say, and what you do are all in harmony. I'm going to play a quick video for you.
I will never forget that cup of coffee. Well, a couple of years ago, I was traveling when my schedule worked out on Christmas Eve. I thought the airport was going to be a zoo, so I got there a couple hours early. It wasn't crowded at all, so for me, that means coffee. So I get down into my Terminal D, and I see the green sign. And when I travel these days, I always wear earbuds, you know, so I'm rocking out to Coldplay. And I see the sign, I get in line, and there's one woman in front of me, and she's having a very animated conversation with the barista. She's kind of waving her arms, and they're both smiling and laughing. So I wasn't in a rush, but out of curiosity, I popped out my earbuds. And sure enough, you know, they're going on about their holidays and their plans and the kids and presents, and she starts to move down the line. So it's my turn to order. And I was greeted with this very warm and sincere welcome. This woman said to me, "Hi, my name's Lily. What's your name?" I said, "I'm Ryan." She said, "Ryan, what can I make for you today?" I said, "Well, I want a grande pumpkin spice latte." She said, "You want whipped cream on that, don't you?" I said, yeah, I want the whipped cream. She said, "I'll tell you what I'm gonna do." She said, "I'm gonna make it extra hot, load it up with whipped cream, sprinkle a little nutmeg on top. That's how I like it. You're gonna love it." I said, "Sounds great." She said, "Where are you going?" I said, "Cleveland." She said, "Are you going back to Cleveland to spend the holiday with your family?" I said, "Yes." Now, at this point, I start looking around for the camera, right? I mean, I'm trying to get a latte. So I move down the line, and the conversation continues, and she's funny. She's asking me questions about my family and our holiday traditions. She's laughing, and I'm laughing, and she hands me my drink and says to me, "Ryan, have a safe trip back to Cleveland. Go create some extraordinary memories with your family. When you come back through the Minneapolis airport, I want you to stop here and tell me all about it." As I get my drink, I start walking away, and I stop and I look back at this woman, and I think to myself, you know, it's Christmas Eve. Most people would rather be anywhere else in the world than serving coffee in an airport. Not her. It was like she was meant to be there. And I couldn't help myself. I had to go back. So I did. I walked back and I said, "Excuse me, Lily." And, you know, she jumps around. "Ryan, is everything okay with the latte?" I said, "No." I said, "The latte is perfect. I just had to come back and ask you, what is your secret to making such meaningful connections over serving coffee?" Well, she corrected me. She said, "Ryan, I'm not serving coffee." I said, "Okay, what are you doing?" She had thought about this. And what she told me was, "I'm pouring happiness into people's lives." I said, "You're pouring what?" Like, what is pouring happiness? And her definition of pouring happiness, she wants to be happy in her life. She wants to be around happy people. She cares about her customers. She wants them to come back. So she chooses, even on Christmas Eve, to smile, to have fun, to help people, to just be happy. Instead of just focusing on how to be successful, focus on how to be helpful. The other thing she understands and masters straight away is the very specific and intentional decision around how she chooses to show up, even on Christmas Eve. You know this. A lot of things happen in work and in our lives that are beyond our sphere of influence or control. She doesn't control the weather in Minneapolis. Trust me, I live there. All she gets to own is how she chooses to respond to those things. Decide how you show up. You know, it's interesting, when I met Lily, and she would have had no way of knowing this, but I was pretty heavy in the heart and had a lot on my mind. My parents, both retired school teachers, married 45 years. About 3 months before that holiday, I got a call from Mom. We got some really tough medical news about Dad. time. It was a terminal diagnosis, and we knew we probably weren't going to have a lot of time. So I was sitting in that airport on Christmas Eve, not in the best place in the world. I will never forget that cup of coffee. When you decide to show up consistently as the best version of who you are, it gives you your best opportunity to meet people where they are. And you never know when someone needs you to be your best.
Hey, pretty powerful. I love that video. So Barbara Fredrickson is a professor at UNC Chapel Hill and actually studies positivity, the science of positivity. And she states that positivity opens us. The first, one second. Oh, sorry about this, guys. So, oftentimes we're asked to write about, things that we are going to improve and things that we're going to, focus on. But, for the sake of this presentation, I want you to think about a forget about it list, something in your life that you just want to forget about it, because, showing up and sharing your feelings and things that you're most interested in is what it's all about. And practicing gratitude is another way to show up. And we are actually going to do our own virtual gratitude exercise. Because, sorry, let's get to this. So I'm having a little technical difficulties with my presentation here. Okay. Sorry about that.
I will never.
Okay, we're just going to move on. So cultivating gratitude. Some tips to cultivate gratitude. Start or end each day by sending 2 or 3 emails, texts, or social media messages to your coworkers, your friends, and families that you feel grateful for. Perhaps take a gratitude walk. Something that we do with my family is play the game high-low cheer at dinner time. It's talking about ways that you were positive and things that didn't go well that day and ways that you could truly work together to improve them. And how about writing thank you notes, physical thank you notes, and putting a stamp on them and putting them in the mail? When is the last time that you wrote a thank you note? Or perhaps even practicing a gratitude meditation. Now, I mentioned Barbara Fredrickson, professor of psychology at UNC Chapel Hill, and she says the negative screams at you, but the positive only whispers. So just before sleep, try practicing this. Ask yourself, what are 3 things that went well today, and what was my role in making them happen? So we're going to do our own little virtual gratitude exercise. And I want everybody to take out your phone, because I know you have it sitting right there next to you. And I want you to scroll through your contacts or your old texts. And I want you to identify someone that you haven't communicated with in over 2 months. And I want you to send that person a text message. And it's a little bit early, so hopefully they're still awake. And include in that message what you appreciate about them and what positive aspect they contributed to your life. So take 2 minutes now to do that. Okay, so everybody got their text sent. It's also often funny to kind of think through, at the end user, who you sent that text to, what their thought was immediately when they saw that text, and just kind of visualize that big smile on their face or kind of what they were thinking. But let's talk a little bit about self-care. Your self-care is the utmost importance, and self-care is an act of celebration that you exist. Because misery loves company, but so does joy. So ask yourself, how can anyone be their best selves if they're too tired, too lonely, too hungry, too angry, if their emotional needs are not being met, if they don't exercise regularly, if their physical health is bad, if they're ignoring their spiritual needs, or if they have no one to talk to about their problems and concerns? Taking care of ourselves or yourselves include eating healthy, getting some type of movement, sleeping between 7 to 9 hours, assessing your thoughts and emotions, and also managing your stress. Now, Christina Maslach is the author of The Cost of Caring. And she says that healthcare providers are trained to put the care of ourselves ahead of themselves, care of others ahead of themselves. It is important to recognize that self-care is not equivalent to selfishness. Rather, self-care is essential for energizing, restoring, and maintaining the physical and emotional stamina to reduce fatigue and manage stress. But at a time when we are working around the clock, it may not be the best time to talk about the joy in medicine or the joy in your work. However, joy in work is about cultivating a sense of purpose, meaning, and fulfillment. And reconnecting with your why is a good suggested strategy. So thinking through and asking yourself, why did you enter this field in the first place? What values are important to you? And what gets you up in the morning? Now, I might want to take a step back further and think through during COVID, rethinking your why and asking yourself, what is important to me now? What holds meaning to me now? And how am I rethinking my priorities? Because getting outdoors is not canceled, music is not canceled, family reading, singing, laughing, hope are all not canceled. One of our insured, Dr. Robert Udelsman, is a surgeon in South Florida. He spends every day of the week working with his hands, but only 5 of those days are in surgery. The other 2 days, Saturday and Sunday, he spends about 20 hours in his open air garage chiseling away at scraps of gumbo limbo wood and turning them into beautiful sculptures. Now, in my little corner of the world, I find a reward in connecting with my boys. We've exercised together, tried a lot of new recipes, did a ton of yard work, and just made the time to have meaningful connections together. We also created these really neat recipe boxes out of tobacco sticks. And for Christmas time, we did the stars with lights. So take a moment and allow yourself to wonder again. Have the changes you had to make because of the pandemic revealed any truths about yourself or your life that may be meaningful? What changes have I been forced to make during this time that have actually made my life better? What were the things that I kept up even in the midst of losing control that were important? And in the past 2 weeks, what has brought me joy? Now, let's look beyond the mirror and ways to make the workplace or the practice whole again. And that's starting with the human. I talked about Gallup as an organization who looks at employee engagement, but what leads to employee happiness? Think about the ways in which you lead as a physician leader and create spaces that enable people to live their best selves. I believe that workplaces are characterized by humanity, which include forgiveness, trust, respect, and inspiration. It's not through programs, but through day-to-day interactions. Now, of course, it's always the manager's fault. That's what Gallup reveals. But think about a time when you experience a good leader or a manager. Overall, how satisfied were you with that person? So some tactics when communicating with your leaders involve empathy, assertiveness, and also clarity. And it's also important to lead ourselves, our families, our practices, and communities during this uncertain time. But we also need to we also need to be vulnerable ourselves. So asking for help is a sign of strength. Today, the mental health needs are so great, and I want to share with you a couple strategies. Understanding anxiety among your employee population, your body's natural response to stress, and a feeling of fear or apprehension about what's to come. And it can spread among your practice. In essence, it's super contagious. It doesn't present with both physical and mental symptoms. Therefore, it's especially important in times of crisis to help others move to a mental and emotional state of safety. How do we do this? Like, what is our role as a leader? When someone shares, ask them to tell you more. Be curious. Acknowledge the fear and ask that person to consider what makes them feel safe. Help them keep in mind that we can't control everything about a situation, and encourage them to change what they think they can and let the rest take its own course. Suggest movement or exercise to expand the body, and also encourage them to avoid temptations such as caffeine, nicotine, and or drugs. Listening is also a powerful tool. It can provide you with more resilience to continue, and it provides a sense of connection and safety to be able to speak their truths when someone who is capable of withholding judgment. And the mental health needs are so great right now. So communicating with your employee assistance program, talk about mental health. I mentioned earlier, it's okay not to be okay. And then leverage the telehealth mental health resources that are available. Be aware that mental health will be an issue for today, for months and years possibly to come. And promote transparency and openness in discussion about mental health concerns. Also, invite people to share their personal stories and listen and also validate. Now, as practices begin bringing people back into the physical workplace, they will need to understand that not everyone's comfort level will be the same. One of our practices is implementing this color wristband. Green is, I'm okay with hugs and high fives. Yellow is okay with talking about it, but not touching. And red is hi, hey, but leave me alone, I'm keeping my distance. Because at the end of the day, production will not happen without people. And when you focus on valuing people, you will see the results, which are increased productivity, positive morale, and better teamwork. You have a role as a leader. Leaders improve employee well-being. So be visible, be grateful, walk with your employees, talk, be honest and communicate a clear plan and stick to it, but also listen, take feedback, and treat employees with respect and dignity. Model self-care and encourage staff to take care of themselves. Because management truly makes a difference. So we need to listen deeply. They need to know that you care. They need to know that you are here for them, and they need to feel like they're seen, heard, and like they matter. So planning forward, keeping a log and keeping it simple, figuring out and being thoughtful about which leaders have emerged as exceptional during this time. What platforms worked within the practice that were successful? What did the practice let go of that were healthy or unhealthy? And what things did the practice add that were really meaningful to people? Because at the end of the day, this is about the people. Most people want to be healthy, and our job is to create proper conditions or an environment that is conducive to being healthy. They include some fundamental needs of your employees: autonomy, mastery, and relatedness. So asking your employees what they care about, what recharges or gives them energy, what are their core values, what brings them joy, what about your work gives you a sense of meaning and purpose, how do you feel supported and valued at work? Crafting this vision or this operating plan is also essential. So positioning wellness as a long-term, cutting-edge, socially responsible, legacy-building, fiscally impactful strategy, because it is. And culture at your practice has to be conscious. The three most powerful metrics that you're measuring to determine success are turnover, employee engagement, customer service, and satisfaction. It's not biometrics. A good friend of mine, Rachel, says that it's time to move from programs to purpose, from scaring to caring, and from compliance to connection, and from an almost exclusive focus on physical health to one that acknowledges and supports the whole person. One of our practices out in Eastern North Carolina have come together to pull off a stress management program through the pandemic, through lots of different aspects of appreciation. They discuss their fears and what they have control over, what they can influence, and identify things that are out of their control. Also, the little buttons behind the ears, because they found that it helped ease their ear pain. And then one of their team members' wedding was impacted by the pandemic, so they decorated her door and made sure she felt some extra love that day. And kindness matters. They had a donation from Kind Bars, and they printed little quotes and passed them out to all their patients and their staff at their practice. So ask yourself, what is your story? How do you celebrate success? What are you doing to practice wellness? How are you creating a safe and inclusive practice environment? Just know that we are in this together, and if there's anything I can do, I'm here to help. So I'll leave you with this final quote, and that is: live with intention, walk to the edge, listen hard, practice wellness, play with abandon, laugh, choose with no regret, appreciate your friends, continue to learn, do what you love, and live as if this is all there is. So thank you for allowing me to be curious with you. And if you wanted to know any more information about Curi and how we approach well-being, self-care, and a number of curated topics that matter the most in medicine, business, and life, feel free to visit our news and knowledge blog at curi.com/news. And here is my phone number and email address should you have any questions after today. Thank you again.
Thank you, Jason. If anybody has any questions for Jason, please put them in the Q&A box. And I'm not seeing any at the moment. So thank you all so much for joining us. And Jason, thank you so much for taking the time to talk with us this morning. And please contact member service at msv.org if you have any questions, and we will post this webinar online. Have a great day, everyone.